If everyone could please be seated. Good morning, everyone. My name is Dr. Christy Lowenstein, and I am the Interim Dean of the Hofstra Northwell School of Nursing and Physician Assistant Studies. I also serve as the Deputy Chief Nursing Officer at South Oaks Hospital, one of the 2 psychiatric hospitals in the Northwell Health System. I would like to welcome you to the Convocation for the class of 2025 for our Distinguished Doctorate in Nursing Practice, Master of Science and Advanced Certificate programs. Today we also honor our Master of Science students in our Cardiovascular Sciences and Perfusion program. We are one of 20 schools in the nation to offer such a program. This is our 8th convocation, and it is an extraordinary celebration. I use the term extraordinary because our graduates are just that, extraordinary. I will share with you how extraordinary they are later in the program. First, I want to thank the president of Hofstra University, Susan Poser, Charlie Reardon, the senior vice president and provost, for their ongoing commitment to our school. I also want to thank President and CEO Michael Dowling from Northwell Health and EVP and CNO Maureen White for their vision and the ongoing commitment and support of the Hofstra School of Nursing and Physician Assistant Studies. It is now my honor to introduce to you the medical director for the Master of Science in Cardiovascular Science and Perfusion Medicine program, Dr. Frank Mineta. Dr. Mineta. Dr. Mineta is a professor of cardiovascular and thoracic surgery at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. He serves as the surgical director for Northwell Health's acute lung injury program, as well as the program director of the Integrated Thoracic Surgery residency at Northwell. He has been active in perfusion education and served as an instructor to perfusion education at the Long Island University Perfusion Training Program prior to becoming the first medical director for the Cardiovascular Science and Perfusion Medicine program at Hofstra Northwell. He also serves as the physician representative for the Perfusion Committee of the New York State Department of Education. He is an outstanding physician, surgeon, teacher, and mentor to perfusion students, medical students, residents, and other healthcare professionals. Dr. Mineta is passionate about teaching and has been recognized for those efforts by receiving such awards and honors as the Silver Scalpel Award for Best Surgical Teaching Resident, Teacher of the Year Award in Cardiothoracic Surgery at Northwell Health, as well as inducted into the Alpha Omega Alpha in 1999 for teaching, and inducted into the Academy of Medical Educators at Northwell in 2019. He is a native Long Islander, received his BS in Nutritional Biochemistry at Cornell University in 1985. He completed medical school at the Medical College of Pennsylvania in 1994 and began his surgical residency at the Albany Medical Center and completed his thoracic surgery residency at the Long Island Jewish Medical Center in 2001. Please join me in welcoming Dr. Frank Mineta.
Good morning. Thank you, Dr. Lowenstein. Thank you, Dr. Duffy. Thank you, Joe and Ed. We started this how long ago? 7 years ago? We've known these guys for probably almost 20 years between the two of them, and without them, this could not be possible. Also, I want to thank Denise Duffy. Please stand, Denise, the den mother who runs the show day to day. She makes all of us look good. Today's a very special day. There's a lot of joy, there's a lot of happiness in the theater, and I want to thank all of the parents, the brothers, the sisters, the friends, for all the support you gave all of the inductees through this past 2 or 3 years, because without you, it would have been much more difficult. So please thank your parents for me. I'm very envious of you guys. Does anybody know what envy means? Envy is when somebody has something that you can never achieve. And I'm very envious because you are all starting out in your careers and you have the world ahead of you. You will become better than you ever thought you could be. You will do things you did not think you could achieve. Think about that. The people up here hope to make you a little bit jealous. Okay? Jealousy is something that you think you can achieve, but you're not sure of. Everybody up here is still very passionate about what they do, how they do it. They move to inspire, they move to make you and everybody else around you and the world they live in better. My goal for all of you is to take the time and make the world a better place. Thank you.
Thank you, Dr. Mineta. I now welcome from the class of 2025, Daniel Lally to speak on behalf of the class.
Wow. First time I've ever been in front of a crowd like this. Good morning. Thank you all for being here. My name is Daniel Lally, and I would like to start out with a quote from one of our leaders, Joe Greco. Who better to speak in front of the class than the guy who doesn't speak at all? Me. So, some of us, we are the Hofstra Perfusion class of 2025. Some of us are. And after nearly 2 years of long hours spent studying, note-taking, trying to learn different bypass circuits and endless acronyms, I'm happy to say that we made it. Thank you. Now let's be honest. It was a little chaotic in the beginning, especially when you don't know the difference between positive and negative pressure, or when you leave volume in the heart by clamping your arterial line. Thank God we had amazing preceptors, even though some days they were more nervous than we were. They helped us learn how to control the chaos and protect our patients. They helped us understand why this field matters so much. Now, I'm more nervous for the drive home. 4 p.m., commuting across New York City, that's way more chaotic than a cardiac OR could ever be. We keep people alive when their hearts or their lungs can't do it alone. And that can be a daunting responsibility. But somehow, despite the stress, the early mornings, the coffee-fueled nights, each and every one of us fell in love with this work. We pushed each other at our clinical sites. We leaned on each other. And even in our darkest hours, when things got tough, we never lost sight of why we're here, to help people, to be the calm in the chaos, to be a part of something bigger than ourselves. Now, before I wrap this up, I want to speak to the class directly and let you all know that you are some of the most intelligent people that I've ever met. And we're all going to do amazing things after this. And who knows, maybe we could be the pioneers to something greater than what we're doing now. And furthermore, I'd like to thank Joe Greco, Ed Delaney, Frank Mineta, and Denise Deputy, of course, for guiding all of us to this point, despite how much of a headache it may have been at times. So yeah, here we are, graduating, soon to be certified licensed perfusionists. And some of us are still catching our breath, and some of us still haven't read Gravely, but all of us are ready. Thank you.
Thank you, Daniel, and congratulations to all of you. I'd like to invite Professor Ed Delaney to come up to the podium.
What? Yeah, I'll do the bridal. Yeah. All right. Yeah, you can advance.
Good morning, everybody. I'm going to talk about the class a little bit. Then we're going to go through some slides, give a couple of words out. I want you to think about the sheer magnitude of what's about to happen. First of all, there is less than 300 perfusionists in the country graduating within the next couple of weeks. We have 16 of them here with us today. There are only 4,900 perfusionists in the US and Canada, so they are about to embark on being part of a group of very highly specialized people that will inevitably save someone's life. Family member, mother, father, grandmother, friend. Over the next few years, they're going to continue, and they're going to continue to learn, take their boards, and get acclimated to the field. But what I'm going to talk about right now is what they did within the 21 months. It's a truly intensive program. And what we did for this class is we took a few extra applicants to give them an opportunity to kind of change their stars, if you will. Once you're a perfusionist, you kind of are on a lifelong journey of education and a lifelong journey to essentially do perfusion. In the 21 months, they were in clinical all day long. They were didactic all day long. They're in a small cohort that started their networking between myself, Dr. Mineta, Joe, and each other. That's their original network group. They're going to lean on those people for years to come, as I have, as Joe has, as Dr. Mineta has. What we did for this program was that we expanded the master's thesis classes. We were able to get them each a project with a cardiac surgeon or a mentor from industry, and we kind of went a little further than we had before. And we, instead of doing case studies and retrospective studies, we did actual projects. And in one of the slides, I'll talk about one of the projects that had an amount of success this year. The other thing we had done was got a perfusion ethics class specifically for perfusion. We embellished on their circuit building courses and brought clinical sites in. And they were the first, in our experience, to use our Science and Innovation Center, Sim Lab, and Classroom. So this class was truly an evolving class that really did everything we kind of threw at them. We pushed their limits every day, and they pushed themselves every day, and they went out and actively learned the material Joe and I asked them to learn. So thank you, students, for doing that. I know it was hard at times. Thank you, parents, family members, for allowing us to have them for that short period of time. And then I'm going to have Christy come back up to do a Dean's Award. Thank you.
So he's going to have to get back up because we would like to give Daniel Lally the Pride Award.
Okay, sorry. Sorry. So our Pride Award is an award Joe and I started at the inception of the program, and it's an award where we pick a student that truly grounded out, and they basically did everything they were supposed to within the program. With Daniel, his academics were great. His clinical preceptors, clinical coordinators all had great feedback. The didactic instructors, all great feedback. His assignments were above and beyond. And we're just really proud of Daniel and what he's accomplished. We also don't tell them that they're winning the award until they get here.
Thanks. Thank you, guys.
Congratulations. It is now my honor to present the Dean's Award to Deanna Picarillo. Deanna has consistently excelled in every assignment. Her grades in each class were well above the program standards. Her ability to think critically and solve problems makes her an excellent perfusionist. Feedback from each preceptor, clinical coordinator, and instructor has been exemplary, and her work has been unparalleled. Congratulations.
Oh, yeah.
All right, go ahead.
So some of the magnitude of what they accomplished, they did nearly 2,500 bypass cases. Some of these cases can last up to 12 hours. They did close to 10,000 clinical hours. That is a monumental amount of work in a 21-month span. When I say they were in the operating room every day, all day and night, this class really went above and beyond. We're super proud of what they accomplished. We can advance. So within the program, we do a number of things, and one of the things we really try to do is meeting participation with the students. And these next couple of slides, they're going to show participation in New York State Society of Perfusion, where they presented, they attended the meetings, participated in the meetings. They went to Cooperstown, New York. They went to Lenox Hill in Manhattan for one of the meetings. We also had a number of one-day symposiums within the Northwell system. We're lucky enough to have the support of the Northwell system, where we can take the students and bring them and have all-day surgical lectures at a site. We've done it at LIJ, we've done it at Manhasset, we've done it at Staten Island, we've done it at Lenox. And we bring in field experts within our own health system, but we also bring in field experts from the community and across the country. This is one of the things I wanted to talk about. So last week, we had a group of young women who went to the Sanibel Perfusion Conference. They did a research project on Quest MPS cardioplegia. Most of you will not know what that is, and that's okay. But the research they did was well beyond what Joe and I expected, and it was truly impressive. We were able to get them internships at the meeting where they learned how to run a national meeting. But also, they inevitably at the end, when they did their presentation, they won an award, the Jeff Riley Memorial Scholarship. And Jeff Riley was a scientist, he was an instructor, a teacher, and he was an innovator in the field of perfusion. So for them to win that award is truly impressive. And I just want to congratulate the girls, because I know they did a really good job and they really worked hard last week. So thank you. And then we're just going to go through some pictures of the class, because it is truly a cohort class that spends a ton of time together. And this is going to be their network for the future, at least their base network. And these are pretty much unbreakable bonds that they've done and built over the last 21 months. It's our new classroom. The other thing I like to put up pictures of them in their environment that they're going to be in and have been in. So we have a number of pictures from them being in the OR. And some of these pictures are really unique because, and the lab also. Some of these pictures are unique because I have previous students now teaching current students. So we're teaching them to give back to the community at large and give back to the Hofstra perfusion program. And then this is where our legacy kind of begins. We have perfusionists all across the country now. We are heavily based in the tri-state area, but we're happy to say that 15 out of the 16 current students have jobs, and the 16th one has a number of offers that they're fielding at this point. And a couple of thank yous. First of all, Denise, thank you. Denise keeps myself and Joe in line all year. Without her, this program does not run. Dr. Mineta, of course, thank you for your support, your mentorship, and guidance. And then the impressive numbers up here. The average perfusion student pumps about 150 to 200 cases in our program. The fact that these perfusionists sat 74 and 86 cases with students, truly impressive. And the fact that these two physicians did cases in 96 and 91 is amazing. Now, without further ado, we're going to announce the class, but I'm going to introduce my counterpart, Director Joe Greco.
Good morning, everybody. We're just waiting for these guys to line up. It's my privilege and honor to be able to present these young men and women to you as we like to say, the future heart pumpers of America. They worked really hard and put in a lot of time, especially with me, when they thought a 3-credit class was a 3-hour lecture and turned out to be the 2 o'clock or 3 o'clock in the afternoon, but never without pizza. So, right, Alex? Never without pizza. All right, it's my pleasure now to start to introduce the class of 2025. First, Kevin Acevedo. Talia Bacharach. Danielle Castellano. Timothy Feist. Connor Gilson. Celia Gordon. Sarah Hussein. My man Daniel Lally. Johnny Laurendini. Alex Nardi. Kylie Overton. Deanna Picarillo. Brittany Purcell. Nikki Rosano. Moses Rivera. Last but not least, Taylor Viana. That, ladies and gentlemen, is the Cardiovascular Science and Perfusion Medicine class of 2025.
All right. It is now my pleasure to introduce our guest speaker, Dr. Margaret Peg Duffy. Dr. Duffy, go ahead. Dr. Duffy is the Chief Nursing Officer and Associate Executive Director of Patient Care Services at Cohen's Children's Medical Center in New Hyde Park, New York. She holds a bachelor's degree in nursing from Niagara University in New York, a master's degree in critical care nursing with a nurse practitioner certificate from SUNY Stony Brook, and a PhD in nursing from Malloy College. She holds advanced certification as a nurse executive. Dr. Duffy has a strong background in nursing administration, critical care nursing, and education. Prior to her current position, she served as the Senior Administrative Director for Nursing Education and Perinatal Services at North Shore University Hospital, Manhasset. Dr. Duffy is an adjunct faculty member of the Hofstra Northwell School of Nursing and PA Studies at Hofstra University. She is engaged in numerous presentations as a guest speaker, lecturer locally, regionally, and nationally on topics of administration, nursing education, and cardiovascular nursing. In 2016, she received the Susan Pollack Award at the Roy Adaptation Association International Workshop and Conference for her research study on patient complexity factors and their influence on nurses' perception of staffing adequacy. Dr. Duffy is a 2025 recipient of the United Hospital Fund's Excellence in Healthcare Award for Quality Improvement Champions, in recognition of her leadership to improve the quality of care, patient safety, and patient experience at Cohen's Children's Medical Center. Dr. Duffy, I welcome you to the podium.
Good morning, and thank you so much, Dr. Lowenstein. It's both an honor and a privilege to address you on this very special occasion. But before we begin, I would like to take a moment to recognize and express our deepest gratitude to the distinguished leaders whose vision and dedication continue to shape the excellence at Hofstra University. Please join me in acknowledging Dr. Susan Poser, President of Hofstra University, Dr. Charlie Reardon, Provost and Senior Vice President for Academic Affairs, Michael Dowling, CEO of Northwell Health, Maureen White, EVP and CNO, Northwell Health, Dr. Christy Lowenstein, our Interim Dean of the Northwell School of Nursing and Physician Assistant Studies, and Dr. Teresa Scaria, Chair of the Department of Nursing. We're also grateful for the dedication and expertise of the program directors, Edward Delaney, Dr. Stephanie Keating, Dr. Patricia Jansen, Dr. Amy Smith, and Dr. Sabrina Petrillo. Each of you plays a vital role in the success of the students and the strength of the academic programs. Thank you for your unwavering commitment. Now, when I was asked to give the keynote address today, I was extremely honored. I've never given a keynote before. So in contemplating my remarks, I did what most of us do in 2025. I asked ChatGPT, what makes a good Convocation keynote address? Now, of course, there were suggestions, so I'm going to outline a couple of them. 1, acknowledge the achievement. 2, offer practical advice. 3, share a personal anecdote. 4, keep it concise. I know that's your favorite. And 5, be inspirational. So that's a pretty decent list that I'm going to try to stick to, especially the part about being concise. Prior to my tenure at Northwell, I spent many years at another academic medical center, and we had the opportunity to attend the yearly commencement ceremony. The president of the university always opened the event with shouting to the assembly, "You did it!" And the crowd would go wild, yelling, clapping, screaming. And I've thought a lot about those moments, and what has always stuck with me is, what does it mean? What is the it? Now, today we celebrate all of you and your achievement in either receiving your Doctor of Nursing practice, your master's degree in nursing, or your master's in cardiovascular science and perfusion. That is your it. But what does it really mean? For each of you here today, that answer is very personal to you. You may be fulfilling a lifelong dream to achieve higher education in your respective fields. Or you may have a distinct career path in mind, one that requires this degree and the academic experience that came along with it. However, what unites all of you is that to get to your it, you had to make many personal sacrifices along the way. For example, many of you probably had to juggle work with school, family demands, I see a lot of strollers here, keeping up with your friends, your family, and your social contexts. Some of you may be even thinking, I'm so glad I don't have to spend every weekend studying now. But you gotta pass those certification exams, so you got a few more to go. The "it" has great meaning to the individuals who came here to support you today. I wish you could see from our vantage point what this audience looks like. They are, whether it's husbands, wives, fathers, mothers, children, friends, or significant others, someone or many someone supported you in countless ways to get to this moment today, and many of them are ringing this room, really supporting you like a cocoon, which is lovely. The faculty today take pride in your "it." I'm confident that they're feeling a sense of accomplishment in your achievement and the part that they played in helping you get to this day. When I look out at this incredible group of graduates, I see great promise in the future of healthcare and nursing. My "it" is that when I look at you, I see the patients and families that will receive better, high-quality care because they will be cared for by you, confident, well-educated graduates of these programs. But how do I know that to be true? It took a long time in healthcare, particularly in nursing, to demonstrate the link between education and improved patient care outcomes. It seems intuitive that this would be the case, but it was only in the early 2000s that the research was done in this area for nursing. So here comes the personal anecdote part. I was very fortunate to know in my life that what career path I was going to follow, and I've come to learn that this is a great gift, knowing at an early age what's going to fulfill you professionally. From the age of 5, I knew I wanted to be a nurse and never veered from that career goal. I even had a nurse lunchbox in first grade. Okay, so you can imagine. When I was in high school, the majority of nursing schools that trained individuals to become registered professional nurses were diploma programs, which in 2025 are no longer in existence. I see some heads shaking. Some of you, many of you are probably thinking, what's a diploma program? Diploma programs were 3 years in length and usually were hospital-based programs. The course of study was centered around the clinical experiences as opposed to baccalaureate programs, which gave you a strong academic foundation. Diploma grads were very strong clinically, having spent the majority of their education in hands-on clinical experiences. When it came time to investigate nursing schools, I visited these programs, and their selling point was always how many college credits you could receive, so eventually you too could get your BSN. So my thought at the time was, why don't I just go get a BSN? Why take that path? So I made my list of programs that I visited and wanted to attend, and I met with my guidance counselor. And she said, no, you are not going to do that. Why would you spend 4 years in college and all that money when you could go to school for 3 years? And when you come out, I'm going to remind you, and this was true, you're going to get paid the same as that individual who went to that diploma program, because at that time there was no academic differential. She said I was very foolish, and getting BSN was a waste of money, because at that time a nurse was a nurse was a nurse. Even at the age of 17, that did not seem right to me. Wouldn't more education make you a better clinician? But I had no facts or data to back that up. It just felt like the right thing to do. So you can imagine I faced a tremendous amount of opposition, but just kept moving towards my dream. I ended up enrolling in a baccalaureate program and received my entry into nursing, the BSN. Now, when I started my program, my next-door neighbor enrolled in an LPN program. After 1 year, she graduates, goes to work. I come home having completed the 1 year. Now, our parents were very good friends, and they couldn't believe I had 3 years of school left. Her mother would constantly tell my mother, there's got to be something wrong with Peg. Why is she taking so long to graduate? There's something wrong mentally there. My mother was always asking me, what do I tell her? How will this make you a better nurse? And I could only say, because it will. It wasn't until 2003, in a study conducted by Dr. Linda Aiken, a doctorally prepared nurse from the University of Pennsylvania, who did the landmark study, Educational Levels of Hospital Nurses and Surgical Patient Mortality, demonstrated that in hospitals with higher proportions of nurses educated at the baccalaureate level or higher, surgical patients experience lower mortality and failure to rescue rates. I was finally able to back up my assumption at the age of 17 that higher education yields improved patient outcomes. The science was finally there. But you can imagine, a couple years after I graduated from my BSN in my neighborhood, when I went back to school to get my master's and my nurse practitioner certificate, my mother's like, please don't tell anybody. I don't even know what a nurse practitioner is. So now back to my ChatGPT list and the last recommendation, which was be inspirational. From this, I'm going to borrow from Reba McEntire, who I saw on a talk show, describing what it takes to be successful. She said that to succeed in life, you need strength in the three most important bones in your body: your wishbone, your backbone, and your funny bone. When I contemplate your ability to make a difference as you graduate today, it's because of the strength you have achieved in all three of those bones. First, your wishbone. This emphasizes the importance of having a goal and a focus with something to aspire towards. This bone provides us with personal motivation and keeps us facing forward. It allows us to dream big. You all dreamed big, and today you're celebrating the fruits of that labor. But never lose the ability to continue to dream and push yourselves in ways that may seem uncomfortable at the time, but will allow you to achieve your goals. Second bone is your backbone. This underlies the importance of mental toughness, being resilient, and seeing things through, having the courage to stand your ground, to stretch yourselves, and attain your goals. This bone is going to keep you on your feet, even the most difficult of times. The majority of you are very accomplished in the role you hold today, which will not be the role you're going to have post-graduation. Once again, you're going to be that newbie with all the anxiety that can come with that. But because you have that backbone and you've achieved great resilience through this academic program, you're going to thrive in the role you're going to be able to assume as a graduate today. And then last, your funny bone. This reminds us we need a sense of humor, the ability to laugh at ourselves, don't take life too seriously, or be self-absorbed. It's okay to make mistakes and be vulnerable on occasion. This final bone helps us stay hopeful and optimistic, and don't take yourself so seriously. Sometimes you need to get a little crazy, but be crazy good. Having a purpose and a sense of humor is no good without the mental attitude required to achieve your goal. But having the goal and the right mental attitude may make you fiercely ambitious, but without some sense of humility, people are unlikely to support your cause. Having the ability to laugh at yourself combined with a resilient nature may well make you extremely robust as an individual, but without any clear plan for yourself or a set of intentions, it's unlikely you're ever going to realize your true potential. So as Reba McEntire wisely advises, nurture your wishbone, strengthen your backbone, and never lose your funny bone. You've demonstrated the great power of these bones through your academic journey, and they will continue to serve you well as you embark on this next exciting chapter in your career. Class of 2025, you did it! Yay! Now go out there and make a difference. We are all incredibly proud of you and eager to see the remarkable things you're going to achieve. Thank you.
All right, thank you, Peg. That was amazing and inspirational. We would like to now welcome our student speaker. The nursing class was given the opportunity to vote on a member of their cohort to represent them and say a few words. The class has nominated Christopher Pepe. Christopher, I welcome you to the podium.
All right, good morning, everyone. Whew. It's a lot of letters at the end of that name. We worked hard for that. We made it. All right. Today is a beautiful day to be here celebrating this accomplishment with everyone. My name is Christopher Pepe, and I am honored to be chosen as a student speaker on behalf of the CRNA and nurse practitioner class of 2025. A little bit about myself. I'm a U.S. Army veteran, and during that service, I saw firsthand overseas the impact that healthcare could have. I chose at that moment that I was going to pursue nursing, and specifically nurse anesthesia. Many of us got into nursing through some major life event. It brought awareness to the beauty and healing that nursing can have. But I'm sure others just had an innate desire to help people. Whatever brought us into this profession, we all got into it because we wanted to help heal people that were going through tough times. We also decided that we weren't just satisfied with being RNs, but we wanted to do something even further and pursue advanced practice nursing. I would like to say, on behalf of this graduating class, we are all here because of the support and guidance that helped us get us through these tough times. I would like to say many of us had help from family, friends, professors, clinical instructors, and colleagues, of course, ChatGPT. We overcame many tough days at class and clinical, keeping our sights set on the prize. When you go to graduate school, life doesn't stop around you. Many of us have had to sacrifice going to life events for family and friends in order to study and attend clinicals. Some of us have welcomed children of our own during this program. Shout out Ellie. Others have even had to leave clinical and go deliver children before returning to clinical just weeks later. The struggles that we have had to overcome to achieve this goal have been immeasurable, and it is why this ceremony is so special to us and our loved ones. Through this program, we have gained the skills and knowledge that are needed to be advanced practice nurses. But we have also continued to grow and nurture the humanistic side of what it means to be a nurse, to help people through some of the toughest times of their lives. For us, it may just be another shift at work, but for our patients and their families, it may be one of the toughest and scariest moments of their lives. We are leaving these programs energetically to step into our new roles as providers and leaders of healthcare. I am humbled and honored to share this moment with all of you. This program, we're leaving here ready to continue making our mark on our patients' lives, and I can say honestly that I would trust any of you with taking care of my family. So, congratulations to all of you, class of 2025, to a wonderful summer celebrating. Thank you.
Thank you, Christopher. It is now time to present the Nursing Students and Faculty Awards. Doctors Keating, Smith, Jansen, and Petrillo, please present the awards for your program. All right. You want to read it? Good. I think we're here first. Okay.
So for the Adult Gerontology Acute Care Program Award, I'd like to call up Nicole Manzi. So Nicole Manzi demonstrates the values we hold at the School of Nursing through her commitment to evidence-based, patient-centered care. She constantly demonstrates advanced critical thinking, leadership skills, and outstanding academic achievement, and embodies the highest standards of graduate nursing excellence.
For the AGACMP Nurse Anesthesia DNP Program Award, I'd like to award this to Samantha DeLandro. Samantha is a dedicated class representative and admission committee volunteer. She has passionately advocated for the CRNA profession, inspiring future nurses at her local high school. Respected and admired across all clinical sites, she has consistently exemplified leadership, professionalism, and heart.
Good morning and welcome. Whoa, I don't need a microphone. It is my absolute pleasure to present the Family Nurse Practitioner Award to Victoria Faraci. Victoria is a kind, strong student who's built upon her nursing knowledge base to grow into a confident and competent NP student. Her presence in the classroom has always been engaging with her insight and experience.
Good morning. It's my pleasure to introduce the recipient for the Psychiatric Nurse Practitioner Program, Nicolette Cruz. Nicolette represents the best in our program, both academically and clinically. I have no doubt she'll be sharing her love of the New York Mets with her future patients, and that she will be a leader for future psychiatric nurse practitioners.
Congratulations to all of you. I now have the pleasure of administering our Dean's Awards. So for the Dean Academic Award, I would like to award that to Jennifer Hazel. Jennifer's spirit and strength have been evident since day one of this program. Her upbeat attitude and willingness to immerse herself in the NP culture have been inspiring. This was apparent to faculty and staff and within the clinical arena, where both preceptors and clinical supervising faculty felt it was terrific for the office staff. It also made patients feel at ease and made the visits pleasurable. We look forward to watching her continue to grow.
Thank you so much. Thank you. You're welcome.
And I would like to award the Dean Clinical Award to Danielle Kosia. Danielle has demonstrated exceptional academic and clinical excellence, earning top grades and evaluations throughout the program. Her commitment to scholarship and practice is reflected in her receipt of this prestigious award. I would like to now invite Dr. Kareem Nagdullah to give our Teachers of the Year awards.
So good morning, everyone. It's a privilege to present this year's Pearls Teacher of the Year Award, an honor made even more meaningful because it comes from the students themselves. This faculty member has gone beyond the role of an educator, serving as a trusted advisor, a steady mentor, and a resource not just to their own Pearls group, but to students across the program. Their guidance has shaped our growth, their presence has anchored us through challenges, and their commitment has elevated the standard for what we expect from ourselves. Please join me in congratulating this year's Pearls Teacher of the Year Award, Dr. Robert Gluck.
Go for the picture. Go for the picture.
Okay, we have one more for Dr. Chanel Grant. She has completed a master's in Hofstra University and finished her DNP in 2022. She is part of the first DNP cohort. She started the National Black Nurses Association for Nassau County, and she has been helping our pathway programs and undergraduate students as a mentor, panelist, and tutor. She is a perfect example of a teacher, a faculty member in our school. Please, everyone, please welcome Dr. Chanel Grant. She's not here? Okay. Well, we tried.
That's okay. I think Dr. Grant was unable to make it this morning, but that's okay. We'll make sure she gets her certificate. So we'd now like to present the class of 2025 for nursing. So I'm going to ask Drs. Karina Lascalzo and Stephanie Keating to present the class.
I'm reading their names. They're handing it to me, or am I? Adrian Anderson. Nitza Augustine. Aaron Brems. Christy Capo. Alpha Chen. Gabrielle Cohen. Jennifer Cohen. Danielle Kasha. Kayla Darenza. Lindsay Davis. Stefan de Torres. You're going to put me on the spot here. What's your last name? Samantha. Okay. You put me on the spot. Samantha Delandro. Ariel Dominguez. I didn't realize that's what we were waiting on. Courtney Draco. Pierre Andre Almera. Victoria Ferracci. Elwin Fernandez. Donata Ferrari. Maria Francesi.
Like that.
Nicholas Gargiulo. Joseph Jacquio. Javier Gonzalez. Laura Gonzalez. Kiera Grassi. Gabriela Graziosa. Sade Hamilton. Samantha John Louis. Catherine Job. Navdeep Kaur. Haley Carney. Jennifer Kirschbaum. Christian Coniars. Peter Katsavolos. Kate Lawler. Please don't. Nicole Mandy. Reed Martinson. Christelle Mathalay. Matthew Michelonis. Shannon Moore. Gabrielle Newbert. Catherine Nowicki. Marilyn Olida. So cute. Andrew Adkalt. Christopher Pepe. Rebecca Pikarski. Virginie St. Germain. I got it. Angela Stanley. Amy Thomas. Gregory Wallach. Philip Young.
And to give Dr. Keating a rest. They gave me the easy names.
Yeah, thank you.
Micah Angelitude. Nicolette Cruz. Ashley Howard. Kayla Holman. Casey Houvain. Congratulations. Sasha Kolech. Alexandra Kopsky. Deborah Leva. Sarah Maxwell. Kaylin McCabe. Vanessa Orlando. Congratulations. Got it. Denasia Pitt. Victoria Romano. Siggy Schwartzman.
Our chair, Dr. Teresa Scaria, will now lead the class in the nursing oath. I'm going to ask our class to rise for the nursing oath.
Okay. So all nursing graduates, all nurses among the all nursing faculty, and all nurses among the guests, please stand up and recite with me. The oath is on page number 5.
The nurses in the audience. Amazing.
It's amazing. Okay. I promise to face challenges and obstacles with courage, strength, and compassion, and excellence, and always remember that on the other side of the important work is a human, someone who loves and is loved. I will continue to challenge existing norms to achieve high quality value-based healthcare outcomes while increasing access to care. I commit to lifelong learning and providing dignity fostering care by integrating the innovations of nursing science with art of healing. I will foster scholarship in a culture of excellence, discovery, integration, application, and education, linking scientific discovery to advance global health. I will remain committed to the paths of excellence, innovation, discovery, and inquiry, and to develop advanced practice nurses and communities of practice. I will respect diversity and have the positively influence future societal norms. Thank you. You can have a seat.
Thank you, Teresa. So, this is a wonderful and exciting day. Today marks a significant milestone for our graduates, whom I've called extraordinary, and I will tell you why. Our perfusion and nursing students have undergone various educational and professional experiences, demonstrating remarkable dedication in serving patients and evolving in the evolving healthcare field. Our nursing graduates, already registered nurses, embarked on their academic journey, most of them, in 2022, while our perfusion students in 2023. These students have navigated the complexities and innovations that arose during their time in that program, as right at the tail end of the worst part of the pandemic, as we were finally taking masks off and could see each other. These graduates exemplified resilience and diligence, successfully completing demanding programs on time. They entered their programs at a time of new opportunities and advancements in healthcare. Each of them courageously chose to advance their careers and become leading practitioners in a vital field, enriching their knowledge and skills to meet the demands of modern healthcare. Our class of 2025 embodies the essence of modern healthcare professionals, exceeding conventional expectations. Besides completing their master's thesis, numerous projects and labs, cardiac perfusion students engaged in pivotal local and national cardiac meetings, embracing both in-person and virtual interactions. Their achievements, resilience, and commitment speaks volumes. Our nursing graduates served in challenging environments within intensive care units and emergency departments, constantly prioritizing patient care. Despite balancing full-time responsibilities, personal commitments, and an unwavering pursuit of further education, their immense grit and determination are a reflection of the class of 2025. It is clear why I regard all our graduates as extraordinary. They persevered, prioritized patient care, and exemplified unwavering courage day after day. This unique group holds a special place of pride as alumni of our institution. Furthermore, I extend my gratitude to the faculty of our nursing and perfusion programs. Renowned for their clinical expertise, they have actively contributed to the evolving healthcare landscape. Their outstanding courage, coupled with unwavering dedication to their students, deserves our applause. They rose to the challenge, embodying the all-hands-on-deck spirit. Our graduates are assuredly poised to uphold the values of our institution: courage, collaboration, humanism, leadership, innovation, learning, scholarship, diversity, global health, and excellence. They have exemplified courage and compassion, embracing shared values and appreciating differences among peers, faculty, and healthcare teams. As you embark on this journey, remember what your patients and instructors have imparted. Know your strengths and acknowledge your knowledge gaps. You carry a profound responsibility to your alma mater, workplace, and society. The depth of pride from our faculty, staff, and myself is immeasurable. You truly are extraordinary. In closing, let me share these words from Ralph Waldo Emerson. Do not follow where the path may lead. Go instead where there is no path and leave a trail. Ladies and gentlemen, the spirit and resolve of the class of 2025 embody these words. You chose to forge new paths in your healthcare careers, not because it was easy, but because it was challenging. And despite the odds, you triumphed. Congratulations to you all. Now I'm going to echo the awards of last year. No one is successful in a vacuum. So will the class of 2025 please stand up and thank your family, friends, faculty, and colleagues who have supported you through your journey, which led you here today. I, too, would like to thank the faculty and staff of the school, as well as the family and friends who have made this day come true. I hope you can all take this time and celebrate. You deserve it. Congratulations to the class of 2025. We are going to take a picture of our graduating class, so we're going to ask that you all proceed outside so that we can take a picture. Thank you. All right, if we could let the students exit first, please. That way we can get them outside for their picture. And then we'll allow the audience to leave. Thank you.